video summary of the original blog found here, https://bmidoctors.com/semaglutide use in yeast infections. Imagine a medication that not only controls your blood sugar but also helps you lose weight. Sounds perfect, right? But what if it came with an unexpected side effect? In recent years, semaglutide has emerged as a significant player in the treatment of type 2 diabetes and weight management and obesity. Developed as a glucagon-like peptide-1, GLP-1, agonist, semaglutide works by enhancing insulin secretion, thereby reducing blood sugar levels. Its increasing popularity is attributed to its effectiveness in glycemic control and its role in weight loss, making it a preferred choice for many healthcare professionals and patients. However, like all medications, semaglutide is not without its side effects. Among these, the occurrence of yeast infections has been a point of concern. Yeast infections, medically known as candidiasis, are caused by the overgrowth of a fungus called Candida, commonly Candida albicans. These infections are particularly uncomfortable and can significantly impact the quality of life, with symptoms ranging from itching and discomfort to more severe complications. Understanding this side effect is crucial as it affects compliance with semaglutide treatment, particularly in long-term therapies for chronic conditions like diabetes and obesity. Semaglutide influences gastrointestinal motility and glucose metabolism, which may create an environment conducive to yeast overgrowth. Patients with diabetes are already at a higher risk of developing infections due to fluctuations in blood sugar levels, which can affect the body's natural defense mechanisms. Therefore, the intersection of semaglutide use and a predisposition to yeast infections becomes an area of critical investigation and discussion. The journey of semaglutide began with the understanding of the GLP-1 hormone, a naturally occurring hormone in the human body. GLP-1 is released in response to food intake and has several important actions. It stimulates the pancreas to produce insulin, inhibits the release of glucagon, and slows gastric emptying. Semaglutide mimics the action of GLP-1, thereby enhancing its beneficial effects on blood sugar regulation and appetite control. Developed through advanced pharmaceutical technology, semaglutide stands out for its unique structure that allows it to have a longer duration of action in the body. Most commonly, semaglutide is administered once a week via subcutaneous injection, which significantly improves patient compliance compared to treatments requiring daily administration. The effectiveness of semaglutide in lowering blood sugar levels and aiding weight loss has been demonstrated in numerous clinical trials. However, the mechanism of semaglutide that slows gastric emptying and alters appetite can also impact other aspects of gastrointestinal physiology. This alteration could potentially create conditions that favor the overgrowth of fungi like Candida, leading to yeast infections. Understanding this side effect is critical for healthcare providers and patients alike to manage the risks effectively while harnessing the benefits of this potent medication. Yeast infections, or candidiasis, are common yet often misunderstood ailments that affect millions worldwide. These infections are caused by the overgrowth of fungi, predominantly of the Candida species, with Candida albicans being the most common culprit. Factors like antibiotic use, hormonal changes, and weakened immune systems are common culprits for yeast infections. For patients with recurring yeast infections, the situation is particularly challenging, significantly impacting the quality of life. In the context of chronic treatments, especially for conditions like diabetes or obesity where semaglutide is prescribed, the risk of yeast infections may be heightened. Semaglutide's mechanism of action, which involves slowing down gastric emptying and altering gut motility, may inadvertently affect the gut's microbial balance. While these effects are beneficial for blood sugar control and weight loss, they might also create conditions favorable for Candida overgrowth. Clinical observations and patient reports have highlighted cases where individuals on semaglutide therapy have experienced yeast infections. These reports are particularly prevalent among patients who have pre-existing risk factors for such infections, including a history of recurrent candidiasis. To better understand this association, several studies have been conducted, aiming to quantify the risk and identify specific patient populations that may be more susceptible. The connection between semaglutide use and yeast infections is a complex interplay of pharmacological, physiological, and immunological factors. Stay informed, stay healthy. Understanding the side effects of your medication is the first step to better health. Keep watching for more insights and tips.